Today's lesson is about headaches. There are a variety of types of headaches. Some are very dangerous and some are just very uncomfortable. The ones that occur daily are usually tension headaches. These are not dangerous. They are uncomfortable, and they usually follow some muscles that encapsulate the scalp. So many people get headaches here. A frontal headache is usually a tension headache because there's usually big muscle bands that go across the scalp here. Lots of people get headaches in the back of their neck. These are tension headaches because there's big muscles that go from the neck up into the scalp, causing tension headaches. Other types of headaches are migraine headaches. Again, migraine headaches are very uncomfortable, but not dangerous. Most of the time people have migraine headaches, they say they're sensitive to light, they're sensitive to what they hear. Most of the time they say they cannot work, they cannot take care of their children, they cannot do the laundry, the yard work. They want to just simply get into bed, go to bed, close everything up, and not see or do anything. When people say these things, they usually have a migraine headache. A third type of headache is a cluster headache. Cluster headaches you don't see very often. These are intense pain, like stabbing pain behind usually one eye. And they're usually men that have these kind of headaches. Chronic paroxysmal hemicrania headaches. This is usually one-sided headaches, usually behind the eye. These are milder than cluster headaches, but like cluster headaches, usually behind the eye. Don't usually see these headaches. They usually are resolvable or treatable with an indomethacin. Structural lesions, aneurysms, these are dangerous headaches. Sometimes people never have a warning sign, and sometimes they do. A good friend of mine was playing volleyball. We were playing volleyball, and he got this terrible, terrible headache when he was playing. When he stopped playing, it went away. We said to him, me and my other teammates said, you better go get that checked out. So he gets it checked out and he has a aneurysm. Unfortunately, they do surgery, they operate, they remove the aneurysm, and he's been just fine. However, other people are unlikely, not as fortunate. What happens is their first warning sign is a really bad headache, and bam, they're dead. That's how bad some of these aneurysms are. Most people don't know they have an aneurysm until they die of it. Sinusitis, sinus infections can also cause headaches. Now, people don't realize they have 4 sets of sinuses, and sometimes people say they have a sinus headache when they really have nasal congestion. If a person has congestion in here, that's a nasal problem, nasal congestion. It's not a sinus problem. You have 4 sets of sinuses. The frontal sinus, the maxillary sinuses, ethmoid sinus, and some other sinuses deep up behind the bridge of the nose. So sometimes people can get a deep sinus headache, and that is a sinus headache. But the problem with that is, of course, we can't distinguish it. It could be other things. It could be like a subdural headache also might feel the same way. But usually people have sinus headaches, sinus infection, they have infection here, or pain here, pain here. They may also have numbness in the side of their face. They might have numbness in their jaw. These are all possible problems with sinus infections. Now, even though we sometimes do, or maybe oftentimes do, depends on who's doing the treating, treat these sinus infections with antibiotics, most of the time they don't need antibiotics, and they're not going to respond. I myself had a terrible, terrible sinus infection, so bad it actually caused me to lose the movement of one of my eyes in a certain way, and actually caused me to have a little bit of double vision. I was treated with 2 courses of antibiotics, and basically they didn't treat it at all. It just went away by itself. How do I know this? Well, it's speculation. It's speculation. They gave me the 1 course of antibiotics, didn't treat it, took another course, and eventually it went away, but it didn't seem like it responded, with an antibiotic. An antibiotic does the trick. Usually you're going to feel better in 3 days. It didn't feel better in 3 days. It took about 2 weeks to start feeling better. Meningitis. Meningitis is of course, a terrible, terrible infection of the meninges. Meninges is a layer that surrounds the brain. It goes down, also surrounding the spinal column, which is why there is oftentimes a back pain associated with back and neck pain associated with meningitis. And the headache that people concern is usually more of a neck to back of the scalp type headache. It is not a frontal headache. It is not a parietal headache. It is the back. And there are certain things that somebody goes into the doctor say, can you move your neck? And they'll say, go ahead, show me you can move your neck. And then maybe some other different tests trying to determine if there's what we call nuchal rigidity, neck rigidity. There's two different types of meningitis. One is viral, one is bacterial. If it's viral, there's very little that can be done for it. It's supportive, just supportive care. Sometimes these people can go back home because there's nothing that can be done, if they're not too bad. However, if it's suspected that the person has bacterial meningitis, they need to go to the emergency room. They need to have certain tests done, like perhaps a CAT scan, a lumbar puncture, or spinal tap, CBC, and if there's any chance that they have meningitis, oftentimes they're started on antibiotics until they can determine that it is not a bacterial meningitis, because bacterial meningitis is so dangerous that a person can actually die if it's bacterial within 24 hours of getting it. Influenza can also cause headaches. You have muscles again around that circle your scalp, and not too long ago I had a very bad headache, and it's right around my head, just like this. It's like a band. And I attributed that to influenza. Even though I had the flu shot and I did not have a fever, I had this terrible headache. And later I saw a couple other patients who had all the symptoms of influenza, the fever, the myalgia, the headaches, and they complained of the same type of headache, a headache that was surrounding their foreheads. Dehydration, if the person's blood pressure goes down, if they've been having a lot of nausea, vomiting, diarrhea, it can decrease their blood pressure, and that's going to cause a headache. A subarachnoid hemorrhage is usually, this, like I said, can be very dangerous. Doesn't have to be. It could be like a slow bleed. Remember, there's different layers. You have your skin, underneath the skin. You have got the skull, underneath the skull. There's a space, we call it epidural space. Underneath that, there's this dural space. Underneath that, there's this subdural space. Underneath that, we have the arachnoid lining, and underneath that, subarachnoid space. That subarachnoid space is sometimes where there's a bleed. Sometimes that bleeding takes a while to evolve. My father had a subarachnoid hemorrhage, and it actually took a couple weeks before he finally got a headache, and he really had to go to the he was starting to lose his balance. When he started to lose his balance, he said, okay, it's time to go see a doctor. Go get a CAT scan and see if there's blood in there. And sure enough, there was. He had a terrible fall, and he fell backwards, and he told me that actually felt like his head had actually bounced on the ground, and at the time it was very cold in the winter, and therefore it would have been just almost like hitting cement. Anyhow, that's a subarachnoid hemorrhage. There's also epidural bleeds and subdural bleeds, and these are actually just as dangerous as subarachnoid hemorrhoid. But the subarachnoid hemorrhoid is the one that people usually describe as the worst headache they've ever had in their life. It's often described as a thunderclap headache. There's also post-traumatic headache. So somebody's out there playing football, they're getting their head banging into other people. We expect, or we're not surprised when they say later in that day they got a headache. Sure, subtraumatic headache. They got their brain or their head, their skull a little bruised, and now they've got a headache. Usually this is not a problem unless there's been a loss of consciousness, and even more so than that is, was there any amnesia? Or did they can remember what happened before they hit their head and what after? what happened after they hit their head, then chances are that it's just a mild concussion. However, if they can't remember what happened before, what happened after, then it's a definite necessity to get a CAT scan. Make sure they're not having some bleeding. There's some other tests that can be done as well. Vertebral artery dissection. So we have many different arteries in our body. We have from our heart, we've got arteries coming up here, and deep inside us is we have our carotid arteries, and our carotid arteries then go into the vertebral arteries. So sometimes these vertebral arteries, inside the arteries, they start breaking down, they start falling apart, ripping apart. And that's called a dissection. The vertebral artery dissection can sometimes cause a headache. As can the next one on our list here is a carotid artery dissection. So the carotid arteries are a little lower, and inside if they start ripping apart, again it can cause a headache. Now naturally these are sort of lower down in our head, so we would expect our headache to be sort of lower down towards our neck area. But we have to take these into consideration when somebody says they have a headache. Carbon monoxide poisoning. There's basically two types of people who get carbon monoxide poisoning. One is those who deliberately do it, trying to commit suicide. So the most common way to get carbon monoxide poisoning is from an automobile, either breathing in some of those fumes deliberately or by accident. Either way oftentimes causes a headache and sleepiness. Unfortunately, there's other ways. Sometimes people will make a type of stove in their home, and they will have some fumes that were produced by the stove, which are carbon monoxide. They'll go to sleep, and sometimes a whole family will die of this. Cerebral venous thrombosis. So deep inside our heads, we have veins and we have arteries. So when the veins have a problem, we call this cerebral venous thrombosis, a clot. Thrombus is a clot. And of course, just like the other one that most people are aware of, cerebral vascular accident, which is an artery that can either clot or can actually burst, they're going to have the same sort of symptoms. They're going to have hemiparesis, one-side weakness, headaches, usually at the beginning, facial weakness, visual changes, hemiparesis, all of those things. We could also have optic neuritis. So we have optic nerves. The optic nerves attach to the back of our eyes and go all the way back to the back of our skull. We call that the occipital region. And underneath that area is where the brain interprets what it sees. Anyhow, this is optic nerve, can be inflamed, irritated, it can start breaking down, and if so, then we have optic neuritis. Now, obviously, it's going to cause pain. Usually, we're also going to have a decrease in vision. This is why somebody says they've got a headache and they're sure that they've also got a decrease in vision. Then this person must be sent to the emergency room where a better evaluation of those optic nerves can be evaluated, because this can lead to blindness if it's not treated correctly and quickly. A cranial mass, a tumor. Usually tumors have a slow onset. There might be a visual change, and that visual change has become slowly over time. Didn't happen acutely, like a headache, like a cluster headache comes on acutely, quickly. Migraines come on quickly. Even a tension headache occurs over 30 minutes to an hour. However, a tumor would be more something that's going to slowly manifest itself. And sometimes it may be worse in the morning. Worse in the morning because the person is laying down. Sometimes it would cause increased intracranial pressure in the morning, and because the person is up most of the day, the intracranial pressure goes down during the later part of the day, therefore the pressure inside their head goes down, therefore their headache goes down. But usually it's going to be a constant, it's near constant, and like I said, slow, progressive headache. Also with a strep throat, sometimes people complain of a headache. People complain of a headache with strep throat. This is not that uncommon. And of course the treatment is Tylenol, Motrin, aspirin, depending on their age. Must be over 18 to get aspirin. Unless of course they have a Kawasaki's disease. And treat the streptococcal infection, usually amoxicillin, Keflex, azithromycin. Preeclampsia headache. So if somebody is pregnant, sometimes later in their pregnancy, 6th, 7th, 8th month, they may get something known as preeclampsia. This is a combination of symptoms probably induced by the placenta, which is putting out hormones, is causing some crazy things to happen in the body, the woman's body. The blood pressure is going up, the protein in their blood is going up, and because the protein of blood goes up, they will also urinate more protein. So that the test for this is to check the blood pressure, check the urine for protein, and also monitor the headache, look for some of the other things that we said can cause a headache. And the treatment for this is oftentimes to deliver the baby early so that neither the mother or the baby suffer any consequences. And the last one I'll talk about is glaucoma. Glaucoma is a pressure that's building up in the anterior, that's a front chamber. You have a front chamber and the back chamber of the eye. And the front chamber of the eye is where a fluid, there's always fluid there, it's always being produced. It's always been produced and then slowly let down and let out. So in glaucoma, there's two different types of glaucoma. There's open angle glaucoma and closed angle glaucoma. Open angle glaucoma is the one that's the higher pressure, the fluid in that atrial or anterior chamber is being let out slowly, so there's an increase in pressure in that chamber, but not all of a sudden. Somebody has closed angle glaucoma, that means there's no fluid getting out of that anterior chamber where it's always continuously being made, and therefore that person's usually going to have a headache right away or eye pain right away. So, and both of these things, if not treated, can lead to a lot of pressure on the optic nerve, and of course if you put pressure on a nerve for long enough, you will kill that nerve. So obviously it's very important to get treatment for glaucoma. And oftentimes the way a person can be determined, there's more than one way. There's if a person has an expensive type of equipment, a tonometry, they can measure the pressure. But another way they can do it is simply by having a doctor look in there and look at their optic disc. If their optic disc is sort of, there's a nice cup and saucer type shape, then they probably do not have glaucoma. On the other hand, if it's their optic disc and saucer is sort of, let's look at what I call squished and smushed, then it's sort of splattered. You can't make out the cup sitting on the saucer so well, and the edges of the disc, optic disc, are blurred, and that person probably has glaucoma. And this concludes my brief talk on headaches. You can see there's a variety of reasons that people get headaches. Most of these things are not dangerous. They're the ones that happen every day. However, occasionally they can be dangerous. Things like meningitis, subarachnoid hemorrhage, vertebral artery dissection, carotid artery dissection, monocarbon monoxide, cerebral vascular accidents, optic neuritis, preeclampsia. Some of these are very dangerous, so sometimes you have to go to see a doctor to be evaluated for your headaches. Let them help you to determine whether your headaches is something that is minor and will go away by itself, or something you need urgent care for in order to prevent permanent loss of a part of the function of your eye or some other part of your body. Thank you and have a good day.